Have you ever wondered why your joints hurt, feel stiff in the morning, or swell up after a long day? Most people think it's just getting old, but it could be something more serious. Today, we're diving into two common types of arthritis, osteoarthritis and rheumatoid arthritis. They might look similar on the surface, but their causes, symptoms, and treatments are completely different. Understanding the difference can change the way you manage your health, or even someone you love. Let's break it down. Welcome back to the channel. In this video, we're going to break down the key differences between osteoarthritis, OA, and rheumatoid arthritis, RA, two of the most common yet often misunderstood joint conditions. While both can cause joint pain, stiffness, and swelling, the underlying causes are very different. One is due to wear and tear. The other is an autoimmune disorder. Understanding these differences is not just important for doctors or physiotherapists, but for anyone who wants to protect their mobility and quality of life. By the end of this video, you'll know how to recognize the symptoms of each TYP, what causes them, how they're diagnosed, and TR. So, let's dive into the details, starting with osteoarthritis. Let's start with osteoarthritis, or OA. This is the most common form of arthritis, especially as people get older. But what exactly is it? Osteoarthritis is a degenerative joint disease, which means it's caused by the gradual wear and tear of the cartilage that cushions our joints. Over time, this cartilage becomes thinner, rougher, or even breaks down completely. Imagine two bones rubbing against each other with less and less protection in between. That's osteoarthritis. It typically affects weight-bearing joints like the knees, hips, lower back, and sometimes the hands, especially the thumb joint. The symptoms? Joint pain, especially after activity. Stiffness in the morning, but usually for less than 30 minutes. Limited range of motion. And in some cases, you might hear or feel a grinding sensation when you move. On X-rays, doctors may see signs like joint space narrowing, bone spurs, small growths at the edge of the bone. Another important point, OA usually affects one joint at a time. So if you have knee pain but your hands are fine, OA could be the cause. Now, let's talk about what helps doctors make the diagnosis. According to the UK's NICE guidelines, 3 things suggest osteoarthritis. You're over 45 years old. You have activity-related joint pain. Your morning stiffness lasts less than 30 minutes. If you check those boxes, it's very likely you're dealing with OA. Now that we understand osteoarthritis, let's explore its autoimmune cousin, rheumatoid arthritis. Now, let's shift gears to rheumatoid. Unlike OA, which is mechanical, RA is an autoimmune disease, meaning your immune system mistakenly attacks your own body. In this case, it targets the lining of your joints, causing inflammation, pain, and eventual damage. And here's the twist. RA doesn't usually wait until you're older. It can strike as early as your 30s or 40s, and it's more common in women. One of the most distinctive features of RA is that it tends to affect multiple joints at once and symmetrically, for example, both wrists, both hands, or both knees. Key symptoms include persistent joint pain in multiple joints, morning stiffness lasting over an hour, swelling, warmth, and redness around the joints, fatigue, and sometimes even low-grade fever. RA often starts in the small joints, like the fingers and wrists, and gradually progresses to larger joints if left untreated. What makes RA especially concerning is that it can lead to joint deformity if not managed early. This is why early diagnosis is critical. To diagnose RA, doctors usually order blood tests to check for inflammation like ESR or CRP, specific antibodies like rheumatoid factor, RF, and anti-CCP, and imaging tests to look for joint erosion and structural damage. RA isn't just about the joints either. It's a systemic disease, meaning it can affect other parts of the body, including the eyes, lungs, and even the heart. Treatment often involves anti-inflammatory medications, disease-modifying antirheumatic drugs, DMARDs like methotrexate, and in more severe cases, biologic therapies that target specific parts of the immune system. These treatments aim to reduce inflammation, slow down joint damage, and improve quality of life. Now that we've covered both OA and RA, let's compare them side by side to really lock in the differences.
Cause.
OA is caused by mechanical wear and tear over time. RA is caused by an autoimmune reaction. Your immune system attacks your joints. Age of onset. OA usually affects people over 45, especially the elderly. RA can appear much earlier, typically between 30 to 50 years old. Gender. OA affects both genders fairly equally. RA is more common in women. Joints affected. OA tends to affect individual joints, often weight-bearing ones like the knees, hips, and spine. RA usually affects multiple joints, especially small joints like the fingers, wrists, and toes, and does so symmetrically. Morning stiffness. OA morning stiffness lasts less than 30 minutes. RA stiffness typically lasts over an hour, sometimes several. Symptoms beyond joints. OA symptoms are mostly localized to the joint. RA is systemic. It can cause fatigue, fever, and even affect organs. Diagnosis tools. OA is often diagnosed with X-rays, showing cartilage loss and bone spurs. RA requires blood tests, RF, anti-CCP, CRP/ESR, and sometimes imaging for joint erosion. Treatment strategy. OA treatment includes lifestyle changes, pain management, and physical therapy. RA treatment involves immune-modulating drugs, anti-inflammatories, and possibly biologics. So now that you understand the difference between osteoarthritis and rheumatoid arthritis, what can you actually do with this information? Here are a few takeaways you can apply right now. Know your symptoms. If your joint pain is from just one area and feels worse after activity, it might be OA. But if you're waking up with stiffness that lasts over an hour, especially in multiple joints, you may need to consider RA. Don't ignore early warning signs. The sooner you get a diagnosis, especially for rheumatoid arthritis, the better your chances of preventing long-term joint damage.
Support your joints,
regardless of which condition it is. Stay active, but don't overdo it. Eat an anti-inflammatory diet. Think leafy greens, omega-3s, whole grains. Maintain a healthy weight to reduce stress on your joints. Talk to a specialist. If you suspect RA, ask your doctor for blood tests. If you're dealing with mechanical joint pain, a physiotherapist can help manage OA. And most importantly, don't self-diagnose. Arthritis is complicated, and getting professional guidance is the smartest move you can make. Taking care of your joints is an investment, not just in mobility, but in independence, confidence, and long-term wellness. And with that, let's wrap it up with a few final thoughts and how you can stay connected with us. Thanks so much for watching. Seriously, We appreciate you taking the time to learn more about your health. If you found this video helpful, do us a favor. Hit that like button. Tap subscribe so you don't miss future uploads. And turn on notifications if you want to catch our next health breakdown right when it drops. Got questions? Drop them in the comments below. We answer as many as we can. And don't forget to check out our Instagram and website for more easy-to-understand health tips, infographics, and bonus content. Stay informed, stay empowered, and we'll see you next time here on your channel name. Take care and protect those joints.